CDC was founded in 2017 and is the technical agency of the African Union. It works on monitoring disease outbreaks, improving the capacity of clinical testing facilities, coordinating the response, training public health officials, and more on-the-ground work. I recently asked its director, Dr. John Nkengasong, what has been the agency's biggest success in combating the coronavirus pandemic?
For Africa CDC, greatest success story for us has been that the pandemic has not taken up in Africa in a manner in which it was projected early on in January. And that is, again, a remarkable situation because there were many projections that outlined and indicated that the continent was going to be hit by a massive storm of COVID-19 and that will lead to many infections and many deaths.
As of this month, nearly 300,000 cases have been reported, according to the agency's daily update dashboard. But there's also been questions of accuracy of the caseload and the fatality numbers being reported by governments around the continent. Are they reliable sources of information? Dr. Nkengasong says leadership in times of crisis is key.
On February 22nd, the African Union Commission, under the leadership of Chairperson Musa Faki, convened an emergency meeting of all ministers of health in Addis Ababa, and they agreed on the need to develop a continental strategy that is underpinned by the need to cooperate, to coordinate, to collaborate, and to communicate. And then, secondly, the establishment of a continental task force. Now, the reason that this is important, for the question you just asked, is that we all agree as a continent at a ministerial level that we need to share information, share data, because we need to know our pandemic. If we do not know our pandemic, we cannot fight the pandemic. It's like we're at war. So I say this to underpin the point that it is now the obligation of all member states of the African Union Commission, all 55 member states, to be forthcoming with data on COVID on the continent and share it with the Africa CDC in a timely fashion that we can process it and then look at trends and use that to at least guide the fight. We are in for a very long battle. The key ingredients as the cornerstone of our strategy to win this long battle and very complicated battle is data, which we must have from the countries. Now, is the data that we are seeing accurate? Well, no data is fully accurate anywhere in the world. Okay, but we have to leave the possibility and reality that because we are not testing enough, we may be missing cases. Not may, we are certain missing cases out there. Because our surveillance systems are weak, our health systems are weak, we are certainly missing cases there. The real question is by how much? Okay, are we missing it by a whole lot, or are we missing a few cases here and there? So as we increase our testing ability, we'll be able to answer that question. The concern that we have is what we are not seeing going to harm. As I've said before, if you do not test, you do not find. So if what we are not finding are going to come back to haunt us, that is the big concern. That's a question that only time will tell.
And the biggest challenge in combating the coronavirus, Dr. Nkengasong says, is to remain vigilant and not declare victory too early.
So we are not yet at the top of the slope, or we are not decreasing. So I think that has to be put in context. And this implies clearly that we cannot be complacent as a continent. We have to enhance our ability to test people, trace those who are the contacts of those who are infected, isolate those who are infected, and then bring those who are infected to treatment. So I think we have to be extremely double efforts to make sure that the situation doesn't get out of hand.